Hey guys, so coming at you straight from the hotel bed here, and looking a little tired, looking a little all natural, um, just trying to let you see the side maybe that I have not shown over the last few years, out of fear or out of pride or out of feeling really vulnerable, which I am right now. Hey guys, so I'd like to start with my story that started 17 years ago when I was 10 years old. So I think it's important for me to say for myself that I do not do these videos for attention. If you know me, it is actually so out of my comfort zone that I cringe every time I watch them back. But the reason that I'm doing it is because for the last 17 years, I have suffered from a disease that just recently has gotten recognition, just recently has got some news clips or some Facebook posts. And I mean within the last year that has happened. However, it still doesn't have the proper testing. It still doesn't have the proper treatment. And as a patient, you still are not respected or looked at as if you have a serious illness, which this is. 10 years old. So I went on a camping trip to Old Forge with my family where I was bit by a tick and exposed to Lyme disease. I had a rash that covered my whole entire body at the time, and my mom took me to the emergency room, and they believed that that was caused by food allergies, something that I had ate that weekend, and told us that we could go home. Everything was all set, which we did, and we assumed that we would just continue on with normal life. However, that is not what happened. So about a week after being exposed to the tick bite, I started to become so exhausted that I couldn't get off the couch. And I remember I was sleeping anywhere from 16 to 20 hours a day, and my mom and I were going on anywhere from 2 to 3 doctor's appointments a week trying to figure out what was wrong with me, visiting various specialists, different primary care doctors, every ER in our area, and I just wasn't
Weeks
getting later, better. I was diagnosed with an autoimmune disease that is known as Crohn's disease because I did, along with the fatigue, have some GI issues, which was the first main system that my Lyme disease attacked, was my intestinal tract. But at the time, we were unaware that it was Lyme, so my first misdiagnosis at age 10 was that I had Crohn's disease. So at age 16 now, I am now in high school, and I still have the Crohn's diagnosis. However, my second system in my body that is attacked by Lyme disease is my muscular skeletal system. So my muscles began to be underdeveloped. I had a lot of muscle cramps and a hard time developing muscle, and my joints became enlarged, swollen, and extremely, extremely painful. And I would say at this time in life, this is when I started to live with chronic pain every day. I was in pain from the minute I woke up to the minute I went to bed. And it was around the clock without any way of getting rid of it. And then the third part of the puzzle that happened in high school was I began to get really severe headaches. So then my third doctor came into play, which was a neurologist. Started to get extreme neck stiffness and pain in my neck, my mobility. So the mobility of my neck was limited, which I saw chiropractic care for, acupuncture, physical therapy. I saw an orthopedic doctor, and also saw a rheumatologist. So then I was diagnosed with rheumatoid arthritis due to the joint pain and stiffness. So now I had a plethora of specialists that I saw in high school and 3 different diagnoses. Guys, where are we? Is it lunchtime yet?